Hello everyone, Chris Gempel, Microsoft, coming from HIMSS 2010 here in the Microsoft booth with Eric Rock from MEDHOST Solutions. Welcome.
Chris, glad to be here.
And thanks for taking time out with us today to educate us a little more about MEDHOST and your solutions. You're CTO and founder of the company.
Yes, I am.
So you have some pretty good knowledge of what we're seeing behind us here and what you're doing within the industry.
I sure do. What you're seeing here is our latest release of our Ops Center product, which is something we're quite proud of. It's our opportunity to carry our solutions throughout the whole hospital and demonstrate our user experience capabilities as well within the healthcare space. This solution is using Microsoft Silverlight technologies, which itself allows for all kinds of user experience opportunities that didn't exist in prior platforms. As an example, you're seeing some highly visual interactions here, including some animations, all with the ability to drill into a deeper experience with data in the system. So at a high level, we're using Silverlight with entirely new solutions for healthcare.
Okay, so what we're seeing here is actually a look into an emergency department?
Correct. So what you're seeing here is a bit more than that. This is a view of the emergency department data that carries through the hospital. It's a view of the impact to the hospital from emergency department data. As you can see here, we drill a little bit deeper with information that represents what's happening throughout the rest of the hospital. So we can see what the saturation level is within units within the hospital. But more importantly, as you said, we're taking data from our EDIS, which is giving us all kinds of value towards the processes within the whole hospital. So specifically, as some examples, we've got a gauge here showing what the saturation level is for the emergency department with some incredible algorithms behind that that are unique to MEDHOST, taking our MEDHOST EDIS data for that. We're also showing some nurse workloads as well as other information here that are all highly visual and in a way that is easy for anybody to understand. So it does not require, for example, any sort of skill set within technology of any kind to be able to easily understand what's going on in the emergency department and the hospital as a whole.
Okay, fantastic. And we saw actually a piece of this at HIMSS 2009 on the Surface unit. And what I thought was really unique about it is this is an actionable piece of software. So it's just not a dashboard. You can actually take action within the solution.
Correct. As you can see, those things that are visible in red are those things that are in alert and requesting action. But we go further than that. We're using mobile devices and emailing to send that information out to those providers that can make a difference, as well as the C-levels within the organization. So when you do get an actionable item, you can use this user interface, drill in a bit deeper, as you can select any one of these devices, or I should say alerts, and drill into the actual patient information and make decisions and take action on those things.
Okay. Yeah, I mean, and as we all know, one of the most inefficient places within a hospital is the emergency department. So
absolutely,
anytime we can drive efficiencies and help the process management piece in, within those workflows, then obviously we're providing value back to the hospitals. Because this is a Microsoft audience, what's your solution built on? What kind of products does it use?
Of course, we're on the Microsoft platform using the latest Visual Studio, but as I mentioned before, Silverlight has provided us some amazing opportunities to provide a rich user experience beyond any other. We're carrying this into mobile devices in the future, but today this is a touchscreen user interface, and MEDHOST brought touchscreen capabilities to the healthcare space, and we continue that with this rich user experience using Silverlight, SQL Server 2008, of course Visual Studio as I've mentioned, and moving forward with some of the mobile devices as well coming from Microsoft.
Have you looked at Windows Phone 7 yet?
Of course we have. We can't wait. So
okay,
we're going to be one of the first to deliver a solution on Windows Phone 7.
Great. We're actually looking forward to it as well. I can't wait to get a new phone, and I guess I have to wait till November for that. So as we wrap up, if there are a few things that you want Microsoft to remember about MEDHOST, what would it be?
Well, first and foremost, we're all about user experience. Our goal is to make sure that providers, C-levels, anybody involved with our solutions can take the fewest number of steps to get to the data that they need and provide that in an actionable way, as you'd mentioned, Chris. So this user interface is, again, very touchscreen oriented, but it'll work great on mobile devices, and as simple as possible is always our goal with our solutions. So first and foremost, user experience and simplicity. Second, high performance architectures are certainly our goals as well. So this solution can be fast, provide that information at your fingertips. If you're there waiting for it after you touch the screen, that's not going to work for anybody. So we make sure that our architectures are stable, fast as well. And lastly, I'd say what we're really trying to accomplish is something that truly, from a data perspective, is meaningful to everybody involved. So we make sure that we're capturing data, utilizing that data properly, and getting any other information we can on the wire that can help individuals with their process. So user experience, performance with the architecture, and utilizing data in a way that's meaningful for everybody involved.
Great. Well, it's a great solution. I know it is. It's a great partner, and it's an area within the hospitals that needs probably the most attention, quite frankly, from a value perspective. So let's go add some value. Let's talk about this and bring it into our hospitals. And Eric, thanks for joining us.
Thank you.
I appreciate the information, and Microsoft, thanks for listening.